Good morning, Mr. Powers. My name is Kalima. I'm a nursing student from Montgomery College. How are you feeling this morning? Do you have any pain this morning? No? Okay. I'm going to assess your abdominal incision and put a new sterile dressing on. I'm going to check your armband. Would you state your birthday for me, please? All right. Going to check my dressing change orders. Okay. All right, Mr. Powers, I'm going to pull your blanket back and your gown up. Okay. I'm going to check the date and the time of the last dressing change. All right, I'm going to go ahead and pull your top dressing off. Okay, I'm going to assess the ABD pad for any drainage or odor. And I'm going to assess the outside of the wound. Do you have any pain when I touch here? No? That's good. No excessive warmth. The peri-wound integrity is intact and slightly pink. No swelling. Now I'm going to take out the packing, being careful not to touch the wound. I'm assessing the packing for any drainage or odor, and if there's drainage, how much drainage is there. Okay. Now I'm going to assess the inside of the wound. Beefy red granulated tissue, which is good. No necrosis. No drainage pooling. Okay. Now I'm going to measure the wound with my sterile cotton-tipped measuring device. Measure top to bottom. The longest point, 13.5 centimeters. And then the width at the widest point, 3 centimeters. Now I'm going to measure inside at the deepest point, okay, 2.5 centimeters. I'm going to check for any tunneling or undermining, of which there are neither. Okay. All right, Mr. Powers, I'm going to wash my hands and start your sterile dressing. All right, Mr. Powers, now we're going to begin your sterile dressing. I'm going to open my sterile dressing change tray. Be very careful to make sure my drape doesn't touch anything. Okay, anything hanging over the side of the table is considered unsterile, as is the 1-inch border. Now I'm going to put everything from my sterile tray onto my sterile field. There goes the tape, that's okay. I have spare tape. Okay, now I'm going to check my normal saline. Okay, it was open this morning, so it's still good to use. I pour off a little bit of the top. Okay, now I'm going to put on my sterile gloves, and I'm going to use this space. I'm going to double check to make sure that it's not wet. Okay, I can readjust that once I get the other one on. Okay, now I have to keep my hands above my waist. Everything below my waist is considered non-sterile. I'm going to add my packing and cleaning gauze to my normal saline. Okay. Take my first gauze to clean the wound from top to bottom, one swoop. Second one to the other side. Top to bottom, one stroke. Okay. Okay, now I'm going to loosely pack the wound. Making sure not to touch the gauze to the outside of the wound. Okay. Two 4x4s over the top. Going to add my ABD. Okay. Extra tape. Time. And my initials and the date. How do you feel, Mr. Powers? Do you have any pain now? No? Okay. And here's your call light. Call us if you need anything, and I'll be back to check on you.